Hey guys, welcome back again to my channel. It's still here. Today I've got an amazing guest. Some of you already know her.
Hey.
She's a registered nurse. I'll let her introduce herself. Let me not start. But as you can already tell from the title, this video we're going to be talking about how she moved from the UK to the US, her process, and everything she has to tell us. So I'll let her introduce herself, and we can get started.
Hi, Nasdale. Thank you for having me in your community. My name is Uche and I'm a registered nurse currently living and working in the United States of America. I've been a nurse for almost 10 years and I have my nursing experience in Nigeria, in the
Mm-hmm.
UK, and now in the USA. I also share insights on nursing. I share insights on career growth and immigration on my YouTube channel. So thank you for having me again.
Yeah. So guys, I'm gonna leave her YouTube name on the screen and her platform so that you can go follow her as well to get in fact anything you need about the US. She's your go-to person. Okay. Okay. So I'm gonna start by asking, how long did you stay in the UK before moving to the US?
I stayed in the UK for 3 years and four
Mm-hmm.
months.
That's a long time.
Yeah.
How was the process like moving from the UK to the US? Just give us a brief explanation.
So for me, I actually started my process together with when I started pursuing my UK immigration because at that point I just wanted to leave Nigeria. So I started this process December 2019. I had to even look for the initial email when I did my CGFNS just to like get things right. So at the time, I think IELTS getting the reading score 7.5 was a bit challenging. So I'm like, okay, this score will be great for the US. So I was pursuing the US, I was pursuing Canada, and I was doing the UK.
Hey.
However, however, the UK kind of clicked for me and my family. So we left. That didn't make me to stop there. So by the time I got to the UK, I continued the whole process and, wrote my NCLEX in the UK. I wrote my NCLEX in 2022 and then we moved in 2024.
Oh, that's
So,
like years after you passed your NCLEX.
yes, yes.
Did you
So,
also face the retrogression going on?
yes, I did. I faced retrogression. I think that's like the common theme now. However, when it works like really quick.
Quick.
So basically, if you want to move to the US as a foreign trained nurse, the
Mm-hmm.
pathway is somewhat the same, but somehow different for people who are trained, like UK trained nurses. So I'm
Mm-hmm.
currently working on that. I have gotten a few details on how people can move from the UK as a UK trained nurse. The pathway is different for everybody, but I'm going to just briefly run down the one that I did as a foreign trained nurse from Nigeria. So the initial thing for you to do is to verify your credentials. It's like your credential evaluation. And you can get this done with CGFNS or ERAS or Joseph Silney. This is depending on the board of nursing that you want to go to. What they basically do is to convert your credential from Nigerian standard or from the standard of the country where you are and
Mm-hmm.
then convert it to the USA standard, if that makes sense. The
Yep.
second thing to do would be to register with a state board of nursing. There are over 50 states in the US, and each of these states have licensure requirements. So when you register with the state board of nursing and meet all the necessary requirements, at the time CGFNS is going to send your CES reports to your selected board of nursing. And then when you're done with all the requirements for that state board of nursing, you can then apply to write your NCLEX.
Mm-hmm.
When you pass your NCLEX, that's actually where more of the journey begins because then you are either going to look for a sponsor through an agency or directly to a hospital. Majority of people go through agency because it takes the burden away from you. And when you have that done, you sign up with the agency, you need to do visa screen. So if you remember at the beginning, I said credential evaluation. So if you've done your CES with CGFNS of Joseph Sinley, you can then do your visa screen. This visa screen lasts for 5 years, and you need an IELTS for your visa screen. So if you have a valid IELTS that you used for maybe your board of nursing, you can quickly use it before it expires for your visa screen. I did that because I didn't want to write again, so I secured I
What score do you
secured
need
it.
for that?
So basically, you just need overall of 7, 6.5 in listening, reading, writing, and but you need 7 in speaking. When you find a job, they will sponsor you or they will be your petitioner. And then you have a job placement, and then whenever USCIS remembers you, you will get your visa invites and then go for your interview. And voila, you have your visa and you can relocate to the United States.
Thank you so much for giving us that process breakdown. But guys, if you want more details, like step by step, please check out our YouTube channel because she's got like step by step. So this is just like a summary of everything. But if you want more details, go to her YouTube channel. You've already answered a little bit of my next question, which is why you moved. You already started your process from the US. But at any point in time when you were in the UK, did you just feel like, I'm already here in the UK now, let me just forget about the US? Do you ever feel like that? Or is there a reason why you say, I'm in the UK, but I still have to leave?
I didn't feel like that. So moving to the US was a bit of personal and professional reasons. Like I said, personal reasons. This is something I started before I relocated to the UK. So UK for me was a ladder to where I really wanted to be. So I've always loved, in fact, from when I was in like uni, I've always looked forward to practicing in the United States. It looks like a dream that would never come, but here we are today. So even when I moved to the UK, I knew that at some point I'm gonna leave, right? Because if I didn't want to leave at the time, by the time I'd written my NCLEX, I'll just file it because I maybe put it under the file that, oh, I'm a USRN. I wouldn't start looking for like a recruitment agency or, taking the steps for that to submit all the necessary documents and all of that. So I knew that a day like this would come. For professional reasons, I was looking at career growth. I just don't want to be like an RN all my life. At some point, I would want to like grow in my career. So I was looking at professional growth. I was looking at, better earning. US earns more than the UK, obviously. I was looking at better weather situations. I really love the weather here. I like when I was in the UK between December and January, most of us at home would just fall sick with cold, flu, and all of that because of the extreme weather at the time. But I love the weather here. I also wanted to experience like a different healthcare system in general. But this argument with US and UK, it will never it will never end. However, yeah, so that was why I still left.
Okay. You've talked about like career progression. In the UK, there's career progression. We've got like different banding. You can become nurse practitioner and all that in the UK. There's still career progression in the UK. Are you trying to say that the ones in the US are more than the one in
There's
the UK?
career progression both sides.
Okay.
But for me as a person, I was looking at career progression more over there. I was a band five in the UK. I didn't pursue for like going into like band six because I knew that eventually I'll leave. That's number one.
Yeah.
Then number two, I worked in ER. And truthfully, before you can step up to that band as a Nigerian or foreign trained nurse, mm, at least we have people that have gone for interviews and they get the feedback they've done very well in interview and then they end up not getting the role. So you either want to leave that department and go somewhere else, or you want to
Mm,
leave like the trust entirely. So
yeah.
that's it. There's career growth
Yeah, I
in
feel
the
like
UK.
most people that move, most of the time they change hospitals. So if you're very flexible,
Yes.
you
Yes. When in the UK, it's very easy when you change either departments or change hospital because is what you give them over your interview. That's the skill they see, right?
true. So are you still working in ER right now in us
I
in
do. It just made sense going on with what I'm used to typically because if I had come here and moved to maybe ICU, I'll be draining
Hey!
by the day.
So like in the
Um,
practice, do you see any difference? Like how is the
there's
practice there and
there's
in the
so
ER both?
much there's so much difference. I
Do you
appreciate the
mind
UK.
sharing just a few?
Yes, I appreciate the UK big time. Of course, I appreciate and when I speak of UK, I speak highly of them as well because most of the skills that I have today as a nurse, I acquired them while I was in the UK. Like when I was in Nigeria, the hospitals that I worked, just to put an IV, it was a doctor's procedure. At some point, you need to like set the tray. If you call a doctor, you have to set the tray for them to go set that IV, right?
Yeah,
However, when I moved to the UK, this was not the case. Doctors come in to help when it's so difficult, and
difficult.
maybe they
Okay.
need to do like an ultrasound, like to get the IV, right? So I would say that skill perfected very well when I was in the UK.
Mm.
And then when I moved here, they didn't need you to start doing like oral medication sign off. Like in the UK, before you can give
You need to be putting.
paracetamol, you need to be watched by a mentor to sign you off or
Yeah.
someone who has been a bigger role or has been in the same band for a longer time, and they will sign you up for oral tablets. You need to be watched before you can, when you learn the IV, you'll be supervised like about 10 times, have your sign off. Same with like majority of the roles. So when I came here, I was a little bit extra careful because when I had preceptors, I'm like, oh, we have this medication, go ahead and give it. I'm like, do I not need to sign off or do I not need to be what? They're like, no, you're registered nurse. That's that you can go ahead and do it. So I feel like this place gave me more opportunities to carry out those skills that I have acquired over time in the UK. And my experience in the UK for over 3 years in the ER also sharpened me here because honestly, if I had moved from Nigeria straight to the United States,
You struggle.
I
Yeah.
would struggle the more. I did find a few things, not always like the 100% the same. It's the same patient goal, patient satisfaction, patient care, but they are done a little bit different. Like when I started working, I had like a few cultural shocks, hospital related cultural shocks. Nigeria, the UK, we call medications by generic name, but here they're solely called on brand names. So most of the medications that your colleagues are calling, you're trying to twist your head like, what are they saying? But when you browse,
I think I watched that your video where you were talking about what they were calling Zofran and
yeah,
ondansetron.
yeah. So when
I
you
was like,
browse it, you see that that's what you know.
yeah, exactly.
So I had my moments within my first week. I'm like, they did not explain this thing to me very well.
True,
It's better experience, right? So that aside, and then when you have a code, you literally see nurses on their game, like the critical thinking skills that you read in your NCLEX. You see United States nurses, you see them
true.
putting it into action. Like in the UK, most of the time when there is a code blue and all of that, nurses on the background helping with maybe passing medication and doing some
Yeah.
other roles. But here, the roles that I see doctors take up during a code in the UK. Nurses take it up here. So the first time I was in a code, I was like, what? What's happening?
You felt like
There's,
that was your real first code, right?
oh, I'm like, there's more expectation. Like, you need to be on top of it. So, yeah, there was a bit of a difference here for me working here. But I would say overall that, I mean, working in the UK kind of helped me because when the same presentation comes into the department, you already know what to do
To
for
do.
those patients. I just needed to follow the hospital protocol where I currently work to achieve that goal. That's it.
Oh, that's good. I mean, it's a bit of a change. It's good.
Yeah.
I
It's a
think
bit
for
of-
that code, like, let me just chip in. I think the code thing, if they have, like, I don't know your trust, like my trust in the UK, we had nurses being part of the code blue. So those nurses are extra trained specialist nurses. So they are like, they've done their ALS, ILS, everything. So they do full on code. Like they have license to give medication during a code. They do
Of
everything.
course.
They pay. So I don't know if it's same in your trust.
My
So when you
trust,
come
right?
for
So
code
in
blue,
the ER, we were trained. We had the trauma immediate life support. We have the ILS. We had
yeah,
the pediatric immediate life support. You're 100% trained, right?
yeah. Mm.
You know what to do in that situation. But here, like, okay, for example, if we have a code, the codes that we had in the UK, you could, before the code even arrives, because obviously the EMS has to like pre-alert there's a code. We kind of share roles. Everybody will have a role. You would be on the airway, you would be
Yeah.
on, fluid, you would be, right? So here, it's similar, but you will see nurses, giving their inputs. Oh, we've given epinephrine. Can we give amiodarone? Oh, we've given
Mm.
amiodarone. Can we, like the thinking process is very, yeah. So I feel like when I had that first experience, I'm like, Uche.
You felt like you didn't know anything, have you?
I felt like I needed
You
to
need to go
actually
back
just.
and read.
I had another training when I came here, but not just reading it. I needed to know it at the top of my finger because, I mean, aside being on the chest and doing the CPR, you actually, it felt different. I felt like I came to a different world of nursing entirely. Like, this is not what I'm reading in the book. This is read the book and practice.
Practice, yeah. Show walking. No be talk.
Yes, yes, yes.
Oh, that's good. I mean, I'm happy you like you've seen the difference and you're happy.
Yeah,
Yeah.
I
Okay,
really love
let's
it
talk
here.
figures. Let's talk figures. Let's see what's like. I know everybody, like most people already know that pay is like better in the US compared to the UK. But like, what's the figures? If you're not particular about it, you can say it. But or you
I
can
would
give us
just talk
like a
about
range.
it,
A
yeah,
range.
in
Yeah.
in general, right?
Yeah.
So basically, The pay depends on various factors. To me, it might be different for someone else. I feel like it depends
Yeah.
on your location, it depends on your experience, it depends on your specialty. Some states in the US pays more. However, the places that pay more will probably have higher cost of living.
Mm.
Yeah, so when people mention such states, they're calling California and all of that. For me, I wanted a balance. I wanted somewhere that the cost of living is not, I'm not living like paycheck to paycheck. That's not the goal, right? That's not the
Yeah.
financial independence. Right? So basically, if you're coming in, it depends on where you're going. Like I said, you could expect anything from, let's say, 39 to 45. It depends on where you are going, like I said. And also, when you gain your experience here, and again, if you come through an agency, you would not expect your rates to be the same as someone who the hospital has
Who did
employed
not?
by themselves.
Yes, that's true.
So it's different. If you've been employed by the hospital, like you finished your contract, you get signed up in another facility, you could have like your sign up bonus. Sign up bonus could be over 20K. And also, if you are a travel nurse, you could earn anything from $65 per hour and above. Remember that even if you earn $35 per hour, there are differentials. If you do like a night shift, you could earn differentials. There were differentials in the UK as well. But
Yes, there
here, if you do like your night shifts over the weekend, you earn like extra $10 over the weekend. So if you do overtime, you're gonna earn like one and a half of your pay. So it's great, really. They always say that the beginning may not always be easy, obviously, because you're being sponsored by your employer. So
Mhm.
you have to like trust the process, finish your
Yeah.
contract, or take a decision that is best for you and your family. That's it.
Are you still under your agency at the moment?
So I came in through a direct hire. They
Oh,
employed
that's good.
me for the hospital. So I'm a hospital staff. The
Okay.
my recruitment agency or the direct hire agency just is like the third party to the hospital. So now my hospital pays me. If you come in through recruitment agencies, the hospital will pay those agency, the agency will pay you. So the benefits for nurses or for employees where I work, I am entitled to those benefits as per my job offer because I'm employed for the hospital, if that makes sense.
Okay. What state are you in, if you don't mind?
I'm in North Carolina. Please come here, guys.
We are coming. So it's North Carolina. Okay. So do you think for nursing wise, like career wise, nursing wise, do you think it is worth it leaving the UK for the US? Like not in general, just nursing wise.
Well, I would say it depends on individual goals. That's why I said that the arguments can never end between people. I watch other creators on YouTube, so I see what people like say in their comment section. Like the debate can never end. So it
Yeah.
depends on your individual goal. For example, for me, I really love it here, not because I'm on your live stream, but I love it here behind the doors. I really love it here more than I was in the UK. I do miss my friends, my church, and my sister. My
Yeah.
sister is in the UK. However, some people kind of message me to say I look a lot happier here. I don't look a lot happier. I am happier here actually. So the same goes for my family. It's been over 4 months since we moved here, so we have
Oh,
adjusted, and we're doing so well. Abba is watching over us. So
yes,
I feel
so
like
he
it's
is. So
yeah, I feel like it's better here. And in addition to this, when I was in the UK, I had like patient ratio in the ER. If you're gonna walk in the step down area or some areas of the ER, you have patient ratio like 6 to 7. But here, my
easy.
patient, yes, if it's
Jesus.
not the resource ED, like the trauma ED, like there are different sections in the ER. So if you're working in that area, you can have like 3 nurses to 4 patients because from that resource, they're either going to ICU or going to, they are poorly, maybe chest pain and all those time based sepsis, time-based care. So that
Mm,
area, you're going to have like 3 nurses to 4 patients. But
okay.
other areas that are not like time-based and so critical, the ratio that I had was 6 to 7, although you had like your nursing assistant or HCA with you. Here, patient ratio is 4 to 5. I've had more fours than I've had five. But
Like
remember,
one nurse
1 nurse to 4 or 1 nurse to 5. But the thing is,
in
remember
in
that
trauma area or triage or resource way.
So triage, you just triage patients and assign them to areas that they need to be seen, right? So when they move from triage, you just take history, take their, put in their vitals and all of that, and then you move them to the areas where they need to be seen. So the ratio is 4. If it's a fast track from where I work, I haven't been, that's the only hospital I currently work. So where I work, if it's a fast track area, you can have like 4 nurses to 7, because there are more things to be done there. But if it's maybe patient that has like a higher ability to be admitted or needs to stay longer for like lab work and all of that, the ratio is 4 to 5. But remember, it is fast paced, because those are not the same patients that you be with all your shifts. So
All the,
yeah, so I would say both countries, they have demanding nursing roles. I'm going to be
I think
truthful.
nothing is nothing.
I would not say that because I have 4 to 5 patients, it is there's no stress. No, some days are better, some days are not. Obviously, you wouldn't know what you will meet at work, but the patient ratio, I really like it. Even though it's fast paced, you see patients, you discharge them, you're having a fresh
Fast.
starts and all of that. So that's the ER. But in the med surg floors, I think the patient ratio in med surg floors is around 6 in the US, which is
Okay.
almost the same in the UK, 6 to 7. So it all depends.
Yeah. Okay, let me even ask a very important thing. You work in the ER. Do you ever feel like scared to go to work, like emergency, anything can come in, like maybe gunshot wound, aggressive relatives, all
No,
that? Face
I
all
don't
those things.
feel scared to go to work, most especially because at my place of work, we have security seated inside
Do you
the
wear a
ER.
body camera?
No, I don't wear body camera. I just have like my work phone and I have a radio. So
Ah,
those
okay.
are two things that I cannot do without, because that is the means of how we communicate with each other. And that's the way that you can alert security if you feel unsafe. Where I'm currently living, because you have to do your research basically to know. For me choosing North Carolina, not because I know anybody here. I came because it ticks the boxes for the things that I needed to look out for moving to the US. So where I currently work, there's always a security, not just at the entrance of the ER, inside. Like they are seated there 24/7. I might be talking to a patient, I can spot security where they are.
Ah,
So
that's
there's extra security. And if you feel unsafe, you can use your radio to, there are measures to take. So I don't feel scared going to work. It's maybe because I've worked in the ER for a long time.
yeah.
So I don't feel like, hey, what am I going to get today? No. On my way to work, I always play gospel music and I am always praying, because at the end of it all, God watches us all. And of
Mm.
course, your license is at the table whenever you're at work. So you need to
Hey, I
like
want to ask
go,
you this question.
you need to
you
like
know,
go well.
Let me ask you this. When we are in the UK, every small thing, protect your pin. Oh. I don't know if your trust
Uh,
does that, but I don't know.
I know they
I
do it
like
a lot.
protect the pin. Oh. Hey, every day you hear your pin, your pin, your pin, your pin. Do
Yes,
you feel
exactly.
that same way? Like,
I
I
don't
don't know,
feel
but
that pressure about, I just know that within me as an individual, I have to
you
protect
have
my
to.
license,
Yeah,
because
yeah.
as a person, this is what I am doing wholeheartedly, and I have children who are counting on me. So I know that aside being there, I have to like practice effectively, and that's it.
Yeah,
But there's
yeah. I mean,
no one has ever said to me you need to like protect your license.
because I don't know, that thing used to give me so
The
much
fear,
anxiety.
yes,
Like,
yes.
I mean, every small thing you do, cover your back, protect your. Hey, do you know, since I've like, oh my
Maybe that
god, like,
mindset still lives in me,
yeah, it just
because
makes you so anxious every time you go to
I
work
feel
when
like
you're
I
in
got to
the UK.
protect my back too.
Anyway, I'm happy that's not there in the US, because that thing gave me so much anxiety when I was in the UK, and I don't wish it on anybody. Okay, guys, I hope you've been able to learn one or two things from her process moving to the US from the UK. And if you're on the same path, please follow her and just use her guide and move to the US as well. I wish you all the best in your UK versus US journey. And yeah, I'll see you guys later. We're going to do a second video, so make sure you watch that video as well. Okay, bye.